Forward. Cool. So I just want to welcome everyone. My name is Carrie Finlay. I'm the coordinator of education abroad in the Office of International Education at the SUNY College of Environmental Science and Forestry in Syracuse, New York. And welcome everyone to today's webinar, which is entitled Off-Grid and Decentralized Water and Wastewater Solutions for Underserved Communities in Israel and the West Bank. This program is co-sponsored by ESF's Department of Environmental Studies and Office of International Education, the Program for the Advancement of Research on Conflict and Collaboration of the Maxwell School at Syracuse University, and of course, our wonderful colleagues at the Arava Institute of Environmental Studies. There is going to be time during the panel to unmute and ask our panelists questions. You're also more than welcome to post any questions or comments in the chat box throughout the presentation, or you can private message me your question and I can read it aloud to the panelists. I'd like to start today's presentation by sharing ESF's land acknowledgement, and I would encourage each of you, wherever you're located in the world, to reflect on the land and indigenous communities where you are. SUNY ESF, as well as Syracuse University, are located on the unceded and ancestral lands of the Onondaga Nation, the center of the 6 nations of the Haudenosaunee Confederacy, who we honor for their many contributions, including the original philosophy and practice of environmental stewardship. So thank you all for attending, and I'm now going to turn this over to Dr. Miri Lavi-Neeman, who is going to be moderating today's conversation.
Thank you, Carrie, and thank you, David, for inviting all of us. And we're very, very excited to be here. And it's a great honor to moderate a panel with my first student at Arava Institute. Farid Mahameed was my first student, and with Clive, who is more like a mentor that like big shoes I should follow at the Institute. So I'm Miri Lavi-Neeman, and I'm at the Arava Institute, and I'm political ecologist trained at UC Berkeley. And I would like to present our 2 presenters. First, Dr. Clive Lipchin, and then Farid Mahameed. They will each speak for 15 minutes, is that right? And then we will pose some questions and collect some questions from the audience for discussion. Carrie, so you'll be collecting the questions through the chat box? Okay, so you can post your questions in the chat box, and right after they're done, we'll have some time for discussion. So first presenter, Dr. Clive Lipchin, serves as the director of the Center for Transboundary Water Management at the Arava Institute. Clive has conducted research for several international water agencies focused on cross-border stream restoration and wastewater management issues between Israel and the Palestinian Authority, and on integrated food, energy, and water system for off-grid communities in Israel, Jordan, and the Palestinian Authority, and the developing world. He is also leading a study in wastewater epidemiology on monitoring the presence of coronavirus in wastewater in Israel and in the West Bank as part of an early warning public health program on combating the spread of the virus in marginalized communities in Israel and the Palestinian Authority. Clive is a native from South Africa. He has been living in Israel for over 20 years, and he holds a bachelor degree in zoology from the University of Witwatersrand and the wildlife management from the University of Pretoria, a master's degree in desert ecology from the Ben-Gurion University of the Negev, and a PhD in research ecology management from the University of Michigan. Clive is also a faculty member at the Arava Institute and teaches courses on water, transboundary water, a very popular one. And Clive, to you.
Thank you, Miri, for that very nice introduction. And I also just want to say that Miri is an amazing person and researcher and a real colleague and an asset to the Arava Institute. And Miri and I are collaborating on work that we're doing and promoting in the Bedouin community. in Israel. So to get started with my 15 minutes, I want to sort of just give a bit of an overview of some of the work that we're doing in this area that we term off-grid or decentralized situations, specifically focusing on the challenges that these communities have with respect to water and wastewater management. So I'm going to share my screen. Make sure I have the right, whoops, I don't have, where is it? Sorry, I have it here, hang on. Let's see why that is. Close this. Okay, that's there.
Clive, until you find your screen, I'll just say that after the two talks, we will kind of draw some concepts from both of your talk, not just draw questions from the audience and kind of charge some terms, what are off-grid communities in the particular context in which we're looking, and how do we think about them more broadly. So there will be time for that as well.
Okay, you know what I'm thinking? I can't, for some reason, it's not showing me the right slides to share. Yeah, I was just going to ask that. Thanks, David. Okay, so who just shared the file? Who did that? Was it Kerry or David?
It was David.
Okay, so David, I'll just let you know when to click through, okay? All right, so let's go. So next slide, please. Okay, thanks. So this is just giving you an overview of the region's water scarcity. What I've tried to do is put some as up-to-date numbers as I have on the water supply and demand deficits for Israel, Palestine, and Jordan, which are the areas of the primary focus of our work at the Arava Institute. And what you can see that all three areas are facing a deficit. With respect to Israel, Israel has something of around 1.8 billion cubic meters of water available per year, but the demand in Israel these days is greater than 2 billion cubic meters of water per year. In Palestine, and we're including here both the West Bank and Gaza, renewable water is somewhere in the vicinity of 200 million cubic meters of water per year. This is nearly almost exclusively groundwater. But the demand is at least double that. And in Jordan, which is actually one of the most water scarce countries in the world, their supply of renewable water is about 1 billion cubic meters per year, while their demand is greater than 1.5. So they have a very serious deficit of at least 500 million cubic meters of water per year. In other words, this is just setting the context of the scarcity in our region. And how we have to start to really think much more comprehensively and much more creatively and innovatively on how to solve these water resources problems. Okay, let's go to the next one, please. Okay, so with that being our introduction, specifically what I'm talking about now is the work that we do at the Arava Institute with our colleagues in both Palestine and Jordan, and also with our Bedouin colleagues, to try to see how do we resolve some of these water scarcity issues, specifically for off-grid communities. And why are we focusing on off-grid communities? Because as you can see here, a large proportion of the world's population is actually off-grid. About 1.3 billion people have limited access to water, sanitation, and electricity. In other words, these are people that are not being adequately served by infrastructure to provide them with the services that we pretty much take for granted. Now, many of these people live in rural and semi-rural communities where one of their biggest challenges is not only providing water to meet their own needs or their domestic needs, but specifically how do they have access to sufficient water resources also for agriculture, whether it be for local agriculture, subsistence-based agriculture, or income-based agriculture. And bottom line is, until such communities have access to efficient water and energy sanitation services, little progress can be made to develop their economies and improve their lives. In other words, there's a major socio-economic aspect to this work as well. Okay, next slide, please. So in our region, around 70% of the Palestinian population in the West Bank can be considered off-grid. In other words, not being adequately serviced by water infrastructure, wastewater infrastructure, and energy. In the case of Jordan, it's approximately 30% of the population. And in Israel, when we talk specifically about the Bedouin population of the Negev, it's roughly 50% of the population. So these are our target communities. This is a case study of one of the projects that we're doing in the West Bank. We're working in the Jordan Valley area, the area there that you can see highlighted in yellow, in a community called Al Uja, which is just north of the city of Jericho. Next slide, please. So a little bit about Al Uja. This is quite typical of the reality of many of the off-grid communities throughout the West Bank. According to the Palestinian Central Group statistics, the total population of Al Uja from 2016, which is the latest information that we have, was just over 5,000 people. Annual rainfall is only 166 millimeters of rain per year. I don't know what it is by your where you guys are in Syracuse, but 166 millimeters per year is, of course, absolutely nothing. It doesn't really do much for water supply. Okay, the water resources, two main water resources in Al Uja. Firstly, Al Uja is provided water by Makorot, the Israeli national water utility, and they have a spring that provides them in the wintertime with certain amounts of water. Now, from the potable water side, you can see that all the houses are connected to water networks. The average water supply per capita is 174 liters per day. They have problems with infrastructure. You can see there are 30% water losses from the main source, and in many times water shortages are common in the summer, and the residents have to supplement their water by purchasing water from tanker trucks. Now, the specific issue of our focus is sanitation, where you can see there is no sewer network in the village. This is very common throughout the West Bank, and therefore wastewater is collected in cesspits or simply discharged into the environment. And many times the cesspits overflow, and then tanker trucks need to be brought in to pump out the cesspits. Now, we estimate that around 118,000 cubic meters of water annually is discharged in this, of wastewater is discharged in this fashion, and there is no wastewater treatment plant in the village. Now, for us, the point is, if I know that there's a significant amount of water, 118,000 NCM per year, can I capture that water? Can I treat it? And can I recycle it and then return it to the residents, to the farmers for irrigation? Because that's a significant amount of water that can help alleviate the water scarcity for this community. So we demonstrate this through implementing off-grid on-site technologies. And this is an example of one of our systems that we have installed in various places in the village and in other communities in the West Bank. This is called an upflow gravel filtration system, where we take the wastewater coming out of the home. In this case, we separate the black water from the gray water. So we're only treating the gray water, but it's gray water that includes the kitchen. So it's somewhere between black and gray, actually. And we have an underground anaerobic system of gravel filtration that basically treats the water. We then pump the water to an above ground disinfection system and expose the water to aerobic treatment. And bottom line is, through this type of system, we are able to return to the user, to the farmer, good quality effluent for the irrigation of tree crops. So this is an adaptation, if you will, for how people in these conditions can supplement the water that they need, specifically for the high demand in irrigation. Okay, next slide. This is a picture of some of my students pensively looking at the aerobic tower where we have the disinfection and the collection of the effluent. Okay, next slide. Now, what we've done is to take an integrative approach. We are combining our upflow gravel filtration systems, as you can see here on the left, with small-scale farming under greenhouses. In the areas that we work with our farmers, we also put into place 80 to 100 square meter greenhouse, where we can effectively channel all of the treated effluent for irrigation for high-value income-generating crops under greenhouse conditions. Next slide. Okay, just before we talk about the Negev Bedouin, the outcome of that project in Al Uja was to also show the economic benefits. So the socioeconomic impact is that by having an additional amount of water for irrigation, farmers can grow high value crops. So in this case, in that greenhouse, we're actually growing tomatoes. And to give you an example, one of the farmers that we're working with that has the system was able to generate between 300 to 500 liters of treated grey water per day to irrigate 1 to 2 tons of tomatoes, and was able to show a significant profit from at least 1 to 2 seasons of tomatoes harvested per year, and irrigating it exclusively with the treated grey water generated from our system. Okay, let's go to the Negev Bedouin. So we started to work also in Israel with the Negev Bedouin. This is just some background information about the Negev Bedouin in Israel. We have they are a significant ethnic minority in Israel, mostly living in the northern and central Negev regions of the country. Many of the Bedouin population are scattered around a number of small villages. Some of these villages are legally recognized by the state, some of them are not. But we have a significant size population that is not being adequately serviced by infrastructure, both in the so-called recognized villages and in the unrecognized villages as well. So their reality is to some degree quite similar to the Palestinian reality, to what we just saw previous. Okay, next slide. Okay, I basically spoke about that, so we can go to the next slide. Okay, this is just a map showing you the distribution of the Bedouin population in the study area. Next slide. Okay, this is one of the outcomes of what happens to untreated sewage. This is actually related to what Fareed is going to talk about afterwards, but here's just giving you an example of what happens when you don't have adequate infrastructure to treat sewage. So this is the Hebron stream that is a significant source of pollution in both the West Bank and in Israel. And what I like about this picture, it shows also the public health hazards of untreated sewage, because you can see here goats and sheep are being grazed by Bedouin, are drinking this water, are being impacted by this water. And that means that when these animals are eaten, there could be an epidemiological pathway between pollution in the wastewater and people's public health. Okay, next slide. Okay, so here you see what I just said, that there's a direct connection between exposure to sewage due to lack of infrastructure and people's mobility. One of the issues facing the Bedouin because of the lack of sewage treatment is high levels of diarrhea diseases, mostly in Bedouin infants. Next slide. And here you can see an example of the risk of cesspits. People can fall into them, drown in these cesspits. Unfortunately, we see some of these issues occurring, and this is just an example from the newspaper. Okay, next slide. Okay, this is just a quote from one of the doctors that works with the Bedouin population, again showing you this connection between morbidity and the lack of sanitation. Next slide. Okay, here you can see cesspits in the example to the left, and you can see it's a very dangerous thing because it's just covered by a piece of corrugated sheet. So you could almost think about, you know, any small child running around can very quickly fall into that. You can see also the sewage running along an open channel. On the right, you can see again untreated sewage just being discharged directly out of from a house. Next slide. Okay, this is just showing you the high level of pollution. We've done a number of water samples, and TNTC basically just means too numerous to count. So we looked at, for example, E. coli and fecal coliform, because fecal coliform is a good indicator for public health hazard in untreated sewage. So very clearly, we see this is definitely an issue. Okay, next slide. To end off my presentation, one of the places we're working in is an area called Wadi Aricha. Miri is very familiar with Wadi Aricha, and she does a lot of work also with the community in Wadi Aricha. It's an example of an unrecognized Bedouin community. Next slide. This is an example of the community. You can see again, very arid, completely off-grid, no water, no electricity, and definitely no sewage treatment. This is a picture of one of our containers that collect sewage, and this is just showing you one of my researchers from a few years ago taking water quality samples. Next slide. This is the type of technology we're installing in the Bedouin community. It's slightly different to what I showed you in terms of the technologies we are implementing in the West Bank, which is a upflow gravel filtration system. What we have here is what we call the so-called vertical green wall, which is basically a technology using a biofilm that attaches on hanging vertical sheets as a substrate, and we trickle the wastewater along these sheets, and the biofilm basically acts as a treatment of the wastewater. This is a type of biological reactor. When the wastewater reaches the bottom, it collects in tanks, and then the treated wastewater is sent to irrigation as well. I'm obviously not giving you the full engineering explanation because I don't have time for that, but I'm happy to get into the actual engineering with anybody on an offline discussion. Next slide, please. This is the system, as you see, arriving in Wadi Aricha on a truck. Next picture. Next slide. And here we are putting the system in place. So again, you can see it's designed to be completely off-grid with solar panels, so we can run exclusively on renewable energy. Next slide. There, the system is in place. You can see the solar panels. You can see the area in green there are the sheets upon which the biofilm grows. Next slide. So here you can see the power coming from solar panels, collecting the raw wastewater. This system is designed to treat anywhere from 2 to 4 cubic meters per day of wastewater. Next slide. We have a monitoring system in place that is remotely operated via a website or a cell phone. We have batteries that allow the system to be operational 24/7. Next slide. This is just an example of some of the data we collect from our monitoring system. This is just showing you, for example, the amount of solar energy being generated over a period of time. Next slide. This is trying to show you how the wastewater trickles down the surface. We have sort of open channels, and the water moves through these channels, and we have perforations along the channels, and the water simply drips or trickles down the sheets, interacting with the biofilm. Next slide. Here you can see the treated effluent being collected at the bottom, which is then sent to irrigation. Next slide. I think I have one or two, or that might be the last one. Okay. Here you see on the left the biofilm, which is the heart of the treatment process, and on the right, using the treated wastewater to grow olive trees, which is a very important and very profitable crop for Bedouins and other similar communities in the region. Here you just see us doing water quality monitoring. This is very important because we need to have consistent data to ensure that the water that is being used for irrigation is safe. Here is an example of how the system is working. You can see the difference between the influent water quality and effluent water quality. So you can see for the most part, the systems are working well. Next slide. And I think this is my final slide. One of the areas that we're continuing to do our research in is to look at the issues of pharmaceuticals and other problematic contaminants, what we call contaminants of emerging concern, such as antibiotics and herbicides, and how we can identify these in wastewater and grey water, and to what degree we can safely remove these contaminants using these types of off-grid technologies. Okay, I think that's my final slide. I really hope I wasn't being too long with my presentation. I won't relate to this this last slide because we may want to talk about that in the Q&A. So I'm going to turn it back to Miri. Thank you so much.
Thank you, Clive. There are already a couple of questions to you for the later discussion. We are moving on to Farid Mahameed, who, in addition to being my first student at the Arava Institute, and he was brilliant on since the very first lesson. Farid is from Al-Fahim, and he currently lives in Omer in the Negev. Farid has a BSc in biomedical engineering from the Technion, a teaching certificate in math from Ben-Gurion University, and a master in environmental public health and industrial hygienist from Haifa University. Farid is an alumni of the Arava Institute for Environmental Studies, and he is the founding member of Al-Motanabi Interdisciplinary School in Kseife, the Negev, a Bedouin town in the Negev. Farid is an environmental educator and sustainability activist in the Arab, Palestinian, and Bedouin societies in Israel and in Palestine, and a transboundary cooperation activist and promoter in the field of sustainability, environment, and education. Farid is coordinator of the Merck COVID-19 project and the co-founder of the Re-envisioning the Middle East seminar series. Farid, to you.
Thank you so much, dear Miri. It's such an honor and pleasure being here today. First of all, I would love to thank everybody for organizing and inviting me, Professor David Sonnenfeld, Francis Gold, Abigail Ben Yohanan, and Kerry Findy. Thank you so much for hosting me. So today, we're gonna look at the COVID-19 from a different perspective, from water perspective, which is less common. So this is our star. This is one of the first electronic microscope picture of the virus when it was when it was the outbreak. So what's corona? Corona, it's a Latin word which means a crown, simply like this. So if you're from Scandinavia, you will tell me that's our national currency. If you're a physician, you will tell me that's the coronary artery and veins that feed up like the heart. If you're a farmer, you're gonna tell me that's the tractor plougher. And if you're from Mexico, you're gonna tell me that's the beer. So nowadays, when I ask you what's corona, nobody gonna tell me any of those. 1 year ago, maybe one of those connotations would have just sprung out into your mind. Now, that's corona. Corona is severe acute respiratory syndrome, coronavirus 2. So from its name, we know it's not the first of its kind. You have the 2. So then you have first SARS virus. So corona, SARS-CoV, the name of the virus, some nomenclature, the name of the virus causes the disease COVID-19, coronavirus disease. So it's caused the corona pandemic. It's part of the coronavirus family. That's very important to know because corona is not a novel virus. The family existed. We have already met some of its relatives in the Mir with the SARS. And it's RNA virus. It's which means that its genetic load is RNA based, and that's important to know because this give the corona and all the RNA virus their mutability, their ability to mutate, because when they infect the host cell, they have this enzyme called reverse transcriptase, which reverse the RNA and rewrites into DNA, and some mistakes fall apart during this reversing process, and that's why we have this mutability also with the flu viruses. So I'm sorry to tell you, but expect to take a vaccine for corona every year at least, because it's gonna mutate all the time, like the flu vaccine that we're taking. So why sampling in wastewater? I'm presenting you a picture, Excel sheet, but pie sheet that I copied from the Israeli Ministry of Health, which shows the testing results for the SARS-CoV-2 virus in 4 Bedouin villages: Sayed, semi-recognized; Tal Sheva, Tal Saba, recognized; Hora, recognized; and Lakia, recognized. So what's the problem? If you look at the data, it looks a little bit out of touch, not a little bit, out of touch with reality. Like in a city which is 32,000 inhabitants, on the 24th of December, on Christmas Eve, you have 0 carriers of the virus in the village. So the numbers are very low. And it seems that there are problems with detecting corona using the, let's say, the traditional method, which are the swab testing, the serological testing. So why using surveillance of the SARS-CoV-2 in wastewater? So the first reason is that most of the virus carriers are asymptomatic, which means that actually they don't know that they have it. Most of us, in some period in our life, we're gonna host the virus. Most of us, we're gonna recover, and we don't know that we even had it. So that's a problem. If you don't know that you are carrier, then there's no reason for you to go get the testing. And that causes a silent community transition, which is dangerous because it then could lead to an outbreak. So also there's the problem of under-testing. And I think the under-testing is the main problem in traditional societies. And that, I think, led to those results that we've seen in the data sheet of the Israeli Ministry of Health. Why they are under-testing? First of all, there's lack to access to health services. So I will just give you an example. The Bedouin villages are like live on the fringe of the periphery of Israel. Israel is usually called, there is the Tel Aviv country, Tel Aviv state, which is the center. It's like New York in the States. And there's the periphery. The Negev is the periphery. And the Bedouin villages live on the fringe of that periphery. So if you recognize Bedouin village, you lack health services. And if you live on unrecognized, like a Bedouin village, like it will make matter worse for you. So if you don't have any service, you can't get the testing done. Second, there's lack of trust between the two communities. Unfortunately, there is a conflict between the Bedouin community, especially those who live in unrecognized village and the states. And this sometimes spills into the epidemiological and the health aspects. People just don't trust the states. They say, oh, it's like some kind of conspiracy. You're trying to get some gains, political gains through those testing, and it creates a conflict. And it's a problem in that without trust, people will just won't go and get the testing done. And also there's the stigma in traditional society, like Arab Bedouin society. Also in Israel, there's the Haredi society. If somebody will know that you have or got tested, it's just like a rumor gonna spread like the virus within inside the community. So people are very reluctant to do it because it's like a culture which is based on what people know about you. So also we have like misinformation regarding SARS-CoV-2, and I can tell you also we have misinformation about the vaccine. To this day, I'm trying to convince some of my colleagues and some of the people I know to get vaccinated. They still have this conspiracy theories about the vaccine. So all of those lead us to think out of the box. And in this case, to look into the wastewater. Actually, wastewater, I think we should now call it gain water, because from an epidemiological point of view, it's a gold mine. Like the excursion of body fluids of the digestive system is going to happen regardless if we like it or not. And imagine if we could install that system in the wastewater infrastructure, then we're going to have an up-to-date up-to-date information about the status, the epidemiological status of that community. So the good thing about this method is specificity with high resolution. And we're actually going upstream detections. First started in the Netherlands, in Amsterdam. And the idea was, instead of causing panic and asking the community to cooperate, we just let them sleep well at night. We do the testing under the ground. Nobody knows about it. And then we just update them with all the data. And if, let's say, we discover the virus in Israel, we have a problem with Bnei Brak, for example, a Haredi ultra-Orthodox Jewish community. Instead of closing all of Bnei Brak, we could have detected the virus in Bnei Brak. Then we were going upstream, going to the end discharge effluent point of every neighborhood. If we could pinpoint the hotspot outbreak of the virus in any of those neighborhoods, we just could close that neighborhood instead of closing all of the city or all of the country in our case. So we're actually piloting a pioneering project in the Bedouin community. And the Arava Institute is actually here with Clive Center is filling the space of the Ministry of Health. Unfortunately, Israel is doing those testing, like the wastewater testing for the SARS-CoV-2 virus, but most of them are in large Jewish established city with infrastructure. So we're actually here doing this very important work to give also an input and reliable data for the community and also for the Ministry of Health, hopefully once we finished our data collection. So we have phase one. Phase one, we actually done a collection of wastewater from the Bedouin villages around the basin of the Hebron River. So the Hebron River starts from Hebron in the West Bank, Palestine. Then it continues through the stream. It enters Israel through the Mitar checkpoints. That's where Clive lives. And there it enters the West Bank sewage catchment facility. It continues until it reaches the Shoket wastewater treating plant. And then it continues until it reaches Gaza and the Mediterranean. So you look at this map. So here we actually positioned our sampling point. So in the catchment facility, we have in the meeting point between the West Bank and Israel, we did the first testing so that we could know what's happening in the West Bank, regardless of the composition, Jewish settlers, Palestinians, or like any of those communities. Then we took samples from Hura, from Sayed, and from Batin, and also from Lakiye here, you could see it, and from Tal Sabet al-Sheba. So here you could see that the villages, the map of the villages, and I would love to thank dear Yunus Raju, he is now participating in this webinar for designing the map. And what's really interesting about our research and novel, that we're one of the first studies to actually collect samples, wastewater samples from natural river streams. And we did that in Batin 1 and Batin 2. And it was exploratory testing because we did not know the threshold. And for one of the testing, we did collect 100 liters per testing, just to test for one site, which is crazy, 100 liters just to check if we have the virus or not. So how does this work? You can see here, this is the infrastructure.
Sorry, 5 minutes? Yeah. Okay,
yeah.
5 minutes.
So it works like this. You can see here the infrastructure map of a town. We're looking for the end discharge point. Once we locate it, we take a sample and then we analyze it. And according to the sample, we can say yes or no. We still don't have this holy grail gold model that we could say the percentage of or the number of the carrier, but then we can go upstream to each neighborhood, to the end discharge point of each neighborhood. And then we can see, test again and look for the specific hotspots. So we did graph sample. Graph sample, just like a snapshot. We just went to the wastewater source. We took a sample and shipped it to the university for analysis. And you can see here, we took it from a manhole, from a river, from end discharge points in infrastructure. And there's the composite sampling. The composite sampling is just continuous sampling throughout the day. And it's the gold standard for wastewater sampling. We collaborated with the Can-Do company and installed an automatic sampler at 3 locations, the West Bank catchment facility, Hura, and Lakiye at Shoket wastewater treating facility. And every Saturday, when most of the people are on holiday, it sampled every half an hour. It took half-liter samples. And the day after, on Sunday, I will come and collect the data and ship them to the university. And the cool thing about it, it's all automatic, and you have an app, and you could control the sample from that app. And there's the Hebron River sampling. You could see the big jerry cans. We actually took huge amounts from the rivers because sometimes we did not get to the detection level. And that's why we need to get to this threshold. And we did the analysis at BGU University at 2 labs, Professor Kushmar and Professor Moran, and we did RT-QR PCR in both labs. So we got some interesting results, and we actually did also some comparison between the two methods. We have two filtration methods in the 2 labs, and we got some correlation. And we could see that there are some concentration, and you could see here those graphs that shows the comparison between the raw and also like the filtered samples. It's just like a controller. And here you see the final results, and what we have seen that actually when the Ministry of Health said that there are no corona SARS-CoV-2 carriers in those villages, we actually detected the virus in those villages. That's very important. And here's a nice picture which show you some kind of correlation. It's not scientifically, let's say, proven, but it's like a nice indicator of like where we're going. You could see that through those dates, you have the active cases per 100,000 inhabitants through the Ministry of Health. And you could see the gene detection in our samples. And you could see that after a while, actually our results did have some kind of correlation. Phase 2, we're hoping to go to the West Bank, and actually we're working on it right now. And the West Bank is very important because it's a transboundary project. It's have a lot of challenges. I will sum it up that here you have like politics, you have epidemiology, and you have bureaucracy combined. And I think this is one of the biggest challenges doing transboundary work, is how actually to speak and communicate with each community it's like a special language code to try to get the sampling and try to convey your message. And hopefully we could now, we're gonna start in this month, start the graph and hopefully the composite sampling. And so that we could also advise the Palestinian Ministry of Health. And you could see here also the pictures of that river, which stems from Hebron. And you could see the gray water. It's because of the slurry influence of the quarries and the stone factories at Hebron. That's very dominant industry there. So here's the map. We're starting from Hebron until reaching the end, until the catchment, the first day at the checkpoint. We're gonna take
Farid,
2
1
graph
minute.
samples. Yeah,
Just
from Al-Fawar, yeah, thank you, from Al-Fawar, and we're gonna take 1 sample also from Raboud, and hopefully composite sampling from the Hebron municipality itself, the Hebron city itself, the infrastructure. So the final phase is going to Gaza. In just today, we got news that there's an outbreak of the SARS-CoV-2 and the COVID-19 pandemic in Gaza. And that's such a shame, because I think if we could have collaborated better between the Israeli and the Palestinian side, we could have prevented this. And this is our aim, is to prevent another outbreak. So thank you so much. I would love to thank also all of the team members of the CPWM, and you can see their pictures. And I'm gonna be glad answering your questions. Thank you, Miri.
Thank you, Farid. I just want to, before we hand on to the audience, the opportunity to ask some questions, and I saw some of them are scientific. I'm not sure everybody in this forum comes from hard sciences, but I want to just spread a little bit of little things that were mainly in what Farid was describing, the kind of questions that we social scientists and science in more political science of the environment draw from these issues. First, I think Farid really nicely ended with a question of boundaries and borders. At Arava Institute, we really we grapple with questions of borders and boundaries all the time. On the one hand, with an uneven development and asymmetries of power on different sides of the borders, also with the production of social boundaries, ethnic boundaries within Israel when it comes to the Bedouins, not just national borders, and also with how we can really cross the borders in many ways. And I think this is really, from a borders perspective, I think these are really two interesting I think, presentations, because if we think about COVID, I think COVID, in a certain way, I think COVID really changed boundaries and borders somehow. During the borders have changed during the pandemic, but also not too much. So they did become more salient, I think, in public discourse. And when we talk about maybe national borders, but also social borders, I think the pandemic really radicalized both borders governance, and also, I think, ethnic boundaries between different groups and between different social groups. So I think there is an interesting question here that you can answer, or just stay with it for after and ponder it, I think. And in this case, how can really this activism, we can say, but also how the non-human agents here, such as the virus or water, each of them with their own particular materialities, as objects of political economies, and as subjects that really pertain risk and benefits for human and environment, how these things, water, wastewater, sewage, viruses, how they really move through spaces and but also challenge hierarchies, maybe of sovereignty or of separations, but also how they can create alliances. And I think here, I mean, I really think we grapple with the question on how we can really create alliances that are meaningful, and not just alliances that reproduce control and power under the coverage of collaboration. I think this is really important for us. The other thing that I'm thinking here is that these are technological transitions, but there are also other transitions that accompany them all the time. And we do different studies in different villages now both in Area C, in Uja also, we just started one, and near Jerusalem, but also in unrecognized Bedouin villages. And we look at these transitions, you know, and of course these transitions are ecological, of course, in the context of climate change also. They're material, they have a lot to do with power, and with they're culturally meaningful. They have a lot to do with political identities. And I think it's really interesting to think how these transition first really, how they, or whether they usher green economic imaginaries in the Negev or in the Palestinian Authority, whether they suggest maybe a novel, you know, socio-ecological fixes, how they if they produce different technology, whether are these technologies liberatory technologies, how they really impact different groups within these different societies. For example, one of the interesting things that we see that the entering these technology, we introducing these technologies, we see how they really change gender roles in villages and between group in the Bedouin society. And we see this also when we now have a research about renewable energy in off-grid communities, and we see how genders are impacted, and new gender identities are shaped differently by these the entrance of the technologies. We see how they produce different visions of citizenship. In some cases, they serve, for example, to help to establish what we call sumud, or the option to stay where you are and as you are in some places when the state doesn't recognize you or you have no status. And in other examples, we see that even though it's still about modernization and more health and such a change, the point is actually it helps, for example, women or other Bedouin people to actually participate in more cycles of citizenship in Israel because of the introduced sort of modernization and improved health. So this is really a very rich ground for a lot of sociological and political research. I also want to say that a lot of the interesting thing that we see is the emergence of new environmental identity in these places, because these people introduce, I mean, you saw this wastewater system in Wadi Ariha, for example, people that live with off-grid wastewater and renewable energy solutions need to live in a very calculated way that in the Western society we don't even know, so they need to calculate their consumptions in ways that modern people or people in the West or people that are connected to grids are not familiar with. And it's really interesting to see what emerge, not just food and agriculture, but what grows in addition to these to agriculture when these technologies are introduced. So I think these are super interesting thing also to think about beyond the technical and technological change. Of course, we need to start with that, of course, because this is the real material change that is happening over there. So I think concluding with that, and maybe just saying that off-grid here is not an arbitrary rural term, but it's also a very charged political term that also has a geography. So Area C is very, very different. And there are a bunch of questions about the kind of interventions that you can do in each of these geographies. Bedouin villages are inside Israel, in the state of Israel. Area C is outside the state of Israel. So sometimes as an NGO, some NGOs, not the Arava Institute, but some NGOs find it really hard to actually work in Bedouin communities inside Israel, and outside Israel it's easier. So sometimes the systems are different, shared by community or individual. These are also really interesting questions that has to do with household and community organizing that is sometimes regional or even local. So concluding with these remarks, I'll hand it on to the audience. Carrie, do you want to present the question, or do you want me to collect them, or?
Yeah, I mean, either is fine. Like if you see any that you think are particularly interesting.
I think we can start by order, just by order.
Sounds good. Yeah, so the first question, these first few are for Clive. So what is the installed or operating cost of the biofilm treatment system installed in the Bedouin community, approximately?
So it varies. The operational cost for the upflow gravel filtration system in the West Bank is quite low. The only issue that has to be considered there is treatment of the gravel. So if there's a blockage or some problematic element is discharged into the system, then the gravel may have to be removed and replaced, or at least washed and reinstalled. So that really is the only major operational element. The carbon filter for disinfection also needs to be replaced every now and again. But we've installed these systems now. We have, I think, if I'm not mistaken, over 20 systems installed throughout the West Bank over the last. I think we began installations more than 5 years ago, and the systems are all working really well. They're actually very robust, and that's part of the design, given the environmental and geographic challenges that we're facing. However, the upflow gravel is designed only to treat grey water, so we still have an issue of including in our design. I didn't mention this in my talk, but including our design modified septic tanks to take care of the black water. On the technology on the Bedouin side, where we use a different technology, the advantage there is that we can treat the entire sewage flow, so we don't have to separate between black and grey. There, the operational costs are very low because there's hardly any technical challenge to having blockages or anything like that, because we don't have gravel. It's just a sheet with a growing biofilm, and as that biofilm grows and dies, it just basically peels off the sheet and then mixes with the water at the bottom. But operational issues is something that you have to incorporate when you plan these kinds of off-grid interventions. So thank you for the question.
Thank you. There was also a question about the efficiency of the systems with solar panels in the wintertime.
So in our area, even in winter, we have very good climatic conditions for solar. We've run our systems over the winter and we've seen no efficiency issues. So they work well in the winter time as well.
The next question was sent as a private message to me asking about the average water supply per capita in liters per day in Bedouin communities.
So it varies very much. It really is quite, you can't come up with one number, but the average, I would say like this, the average for maybe Miri also has a response to this question, but I would say that the average water consumption per day is anywhere on a low end of 70 liters of water per day, which is below basic water needs, to probably slightly more than 100 liters of water per day. But that's a very average. I'm not familiar of any studies that have actually specifically quantified this, but maybe Miri, you can jump into this.
I think it would be a very to create an average would be a very abstracting act, for these communities, because it really depends on sources of income and live, how they make their living, if they have grazing or not, and do they do agriculture or not, and there is a great variety in terms of the communities that we are speaking of here. I mean, they're recognized and unrecognized, and it's very different. So I think it's a really hard one to answer, actually. I mean, maybe it would be interesting to run a survey and see, what's the difference between different types of community, maybe, and see the differences between them, I guess. Do you want me to take the next one? It was about gender roles, right? I think.
Yes, go for it.
Okay, so there was a question here. I'd like to hear more about gender and other role shifts with the provision of more centralized water supply and wastewater. So I just want to say that we did a little not very thorough study of gender roles in direct regards to wastewater, but we did study solar energy and also on as also partly wastewater and changes in gender identities only in the Bedouin sector. We haven't done anything about water and gender yet in Area C, only about renewable energy. We see different kind of things. First, of course, like in many places in the developing world, women are the greatest beneficiaries of these changes because first, because traditionally women, and maybe Farid, maybe you can add to that too. Farid was actually one of our interviewees in a survey we did about food production, and you actually represented the men that are forgotten in many cases when we talk about the Bedouin society. But I do want to say that the women are benefiting from this in a great way because when they have more water, first because they take care of people when they are ill. So that's the burden of bringing water from distant places, watching the kids from risks, and also taking care of if someone becomes ill in the family, this burden is on women. So once women have more electricity and more water, so in terms of electricity, of course, it's extend the day and enable also the introduction of some appliances that alleviate their life in many ways, like washing machine. But these are very simple washing machine, and also in terms of cooking and hygiene and things like this. So so we can see in terms of energy, we do see, for example, that women, for example, can study more because after they finish with all the tasks they had to cover during the day, they can have more light, for example, to sit down and study. And we do see in terms of masculinity, we do see that I think men that become involved in other eco-oriented kind of projects like ecotourism in Wadi Aricha. It's very visible. It enabled them to actually become entrepreneurs and bring tourists in and have flush toilets and things like this that ecotourism actually requires. And then they can provide for the family, and Bedouin men, if they don't provide for the family in these type of communities, they work in the service economy in doing things that they are not very proud to work in many cases. We also see a new trend of women growing food organically, and also developing another type of agro/ecotourism in Bedouin villages. In Batin, it is becoming highly developed. We see women organizing around food production that is enabled through the introduction of these systems. So, and there is way more to say about single mothers and things like this. So.
Thank you. I know we're at time, but Francis had a question, I think for Fareed, which I thought was really interesting. So if we can maybe take just a minute. She had a question about how has Israel gone about tracking COVID statistics in unrecognized versus recognized Bedouin villages, and what impact does this have on the resources the villages receive and on Israel's public health policy at large?
Thank you for the questions. I would love to say, in contrast to Israel vaccination campaign, which was very successful, like the best in the world so far, its pandemic, let's say, reactory campaign or like reactory policy was not that successful. We called it the traffic light policy. And unfortunately, in Israel, we have like what's called the head of the Corona project projector, like who's running the show regarding the corona and all of like the pandemic, but it's very political. So what we were seeing all the time was actually not a very epidemiological approach. It was more of a political approach. And for example, just will give you one small example. The Haredi community lives in Bnei Brak, and they have like one of the earliest outbreak, but because of their political power that they exert, the government hands was handcuffed in trying to detect and trying to implement some policies there. So it was like off limits of the authority. For example, in the Arab villages, because of lack of infrastructure, also because of different cultural background, the communication was not very efficient. So I would love to start from this. So we actually have very, I will not say chaotic, but unrecognized, unorganized policy trying to moderate like the spread of the pandemic. So regarding the unrecognized and recognized villages. So here I would love like to add another term, semi-recognized. So you have 7 recognized villages, which are, you have actually one city, 6 villages and Rahat, the city, which is the second largest Arab city in the country. And those are recognized with infrastructure. They have clinics, but again, they need a lot of investment in their health services, and their like health, let's say the health service is still very at its infancy. And there are the semi-recognized. What does that mean, semi-recognized? So you have 2 regional councils, El Qassoum and Wahat al-Sahra, which runs the collection of villages that the state of Israel recognize that they exist. They are on the map. They're under the jurisdiction of those 2 councils, but they still don't have infrastructure, or their infrastructure is still being built. So those have, some of those have clinics, some of those don't have, and they will need to go to the next nearest clinic at the next nearest recognized village, or to Bir Sabah, Bir Sheva, the center, like the capital of the Naqab Negev. And you have the communities that are totally unrecognized. They're actually not on the map of the state. Like there's the town called El Fura, which is, you have like 5,000 inhabitants, and it's not recognized by anyone. So those actually need to go to the next Jewish or also to the next Bedouin village to do the testing. The problem with the testing was all the time that it was in a hindsight. there was no planning, there was no engagement, it came late. And the biggest problem, for example, with the Bedouin community and the Arab community at large was the weddings. And it feels that the states gave a blind eye to some of those events and just preferred to keep them there and not try to communicate, to have this policy that is catered to the special needs of this community. So I think in looking for the Bedouin community, we need to invest, first of all, in infrastructure, health infrastructure, clinics, more health service people. And also, this is the most important thing, we need to know how to communicate risks with this community in a respectful way that is actually is not paternalistic, but it's like it's more of like cooperative. And I think this model also should be implemented with the Haredi community in Israel.
Carrie, are we near ending here?
I think so, yes. Did anyone have any last comments or thoughts that they wanted to share?
David, do you want to say anything for the end, or should I? I just want to thank Clive and Fareed and everybody who came to listen, and also all of you organizers. Thank you so much for putting this together.
Yes, I'd like to thank our presenters today, and Abigail and Francis for initiating this. It's a big topic. There are many dimensions, and I know for myself, I've learned a lot about both the particulars of off-grid and decentralized water and wastewater treatment in both Israel and in the West Bank, and have learned so much about some of the challenges of COVID tracing in the Bedouin communities. So there's a lot more to learn, and we look forward to learning more as you're able to have additional experiences and share more. So thank you so much. Thank you also for those who were able to join us today for your questions.
I'll just add, thank you everyone for joining. Clive, Miri, Fareed, it's always a pleasure hearing you. If anybody has any questions about the Arab Institute, we are a partner institution of SUNY ESF. So if anyone has any questions about study abroad opportunities or internship opportunities, or would just like to learn more about the Arab Institute in a more general sense, you can email me. I put my email address in the chat, and also our website for more information. And you can also be in touch with Carrie about study abroad. But thank you.
Yeah, thank you so much, everyone who attended, and thank you 1,000 times to our wonderful panelists and to Miri for facilitating that discussion. So I hope that everyone enjoys the rest of their day and the rest of your week, and that wherever you are, you're taking care and are able to, stay safe.